seen my signature enough, I recognize it. Be like, all right, that's that one I can't read.
Well, it's 5 o'clock.
Dave.
I'd like to call the Health and Human Services Board to order on April 19th. Roll call, please.
Julie Medeiros. Dr. Anwar. Lisa Lind.
Here.
Sean Anderson.
Here.
Kathy Leaf.
Present.
Dave Osnes. Greg Telejohn.
Here.
Mike Barkalow.
Present.
Deb Lindeman.
Here.
We have a quorum. Minutes were circulated. Hearing no objections, they'll stand approved as presented. Any objections? Corrections? No. They stand approved as presented. Public comment. Anybody here for public comment? No. Thank you, everybody. Business items. Health and Human Services monthly financials.
Okay. The financials through March of 2023 were included in the board packet. It's April, but we're already starting to look on the 2024 budget. And there's just a couple of things I wanted to point out from 2022 to 2023 that will affect kind of what we're doing here in 2024. If we look on page 13, just with behavioral health, when you look at the tax levy balance in 2022, we had $1,720,000. When you look at our 2023 budget, that had dropped way down, and that was adult protection and elder abuse in 2022. They were under behavioral health. In 2023, we budgeted for them under ADRC. So that was where that big change came from. In 2024, they'll get moved back to behavioral health. So it will not have any impact on the HHS budget as a whole, but between the two departments, you'll see that shifting in the tax levy amount. Other comments, so during the month of April, we had received the additional 2022 revenue that I was aware of, so everything that I was aware is coming in has been received. That'll show up in next month's financials. They're not yet in this one. And then down to page 23 for the healthcare campus. So we previously had gotten an interim rate for our medical assistants. We did receive the final rate for medical assistants that went back to July 1st of 2022. So the staff at the nursing home just got that recalculated. So there'll be an additional $70,720 from medical assistants and $5,462 from family care. That will be posted back to 2022 for the skilled nursing facility. In addition to that, January and February of this year did not have that final rate in it yet, so we'll have an additional adjustment for this year's revenue as well. We're continuing work on the healthcare campus audit, and we just started our Medicare and Medicaid cost reports, and the Medicaid cost report is what will determine our rates for the upcoming July 2023 Medicaid rate. Other thing I noticed, so we switched to Veterans Services. They received some additional funding from the Department of Veterans Affairs, so $19,178 just, they had gotten their $14,300 in as their normal CSVO grant, and then the additional funding that they received that Phil will be spending. So any questions on any of the financials?
Doesn't appear to be. Oh. Thank you.
Okay.
Next item is Health and Human Services Board orientation presentation from the healthcare campus.
Yep.
Good evening. I didn't put many slides in, but I did put some pictures in of the campus. Of course, the org chart is in there. And then I just want to talk a little bit about each of the facilities. The skilled care facilities right now, we're doing, our case mix is extremely important. And we have to maintain a good mix of rehab, long-term care, and we recently have joined with 4 different hospice agencies that we are now doing a lot of hospice care for the communities. Right now we have, as of today, we have 8 hospice residents. We have had up to 10 hospice residents. And in 2022, our Medicare rehab was average 7.1. The one thing I do want to point out about what's been going on at the health center is in 2021, we admitted 87 residents. In 2022, we admitted 129 residents. We discharged 125 residents, and 86 of those residents returned to their home or to a lesser restrictive setting. So those are the rehab residents. The other thing that I think is really important to mention is our nurse educator is doing a lot of our CNA training for a lot of the county homes, the whole county, different facilities. And last year, she trained 32 CNAs, 28 personal care workers, and 28 people for the county and the facility in CPR, along with doing our fit testing and some of the other education that is required for our facility. Does anybody have any questions about the skilled facility? Now, the difference between the skilled facility and Orchard View Terrace is there's a skilled need. That's a resident that's in the skilled facility requires a licensed nurse to be overseeing their care 24 hours a day. Are their conditions not stable, they're declining, or they're getting better? So that's the difference between the skilled facility and Orchard View. Orchard View Terrace honestly doesn't require any nursing staff, an on-call RN, but we have put RNs in our building to provide better care for our Orchard View Terrace residents. I'm really pleased to say, as of today, Orchard View Terrace on our first floor, which is our frail elderly, have 2 studios open and 1 bedroom. The second floor memory care has 1 studio open and 2 one-bedroom apartments. And Jana, my nurse manager, can't wait till we're full because she wants to be able to say, I'll put you on the waiting list. So we're very, very close to being full in Orchard View Terrace. And that's the home and community-based waiver. We are able to accept family care. The one other thing I want to bring up about what's going on with long-term care and aging is there seems to be a lot more elderly people that are getting into situations that requires APS to be involved, where they haven't paid their taxes, they have no heat, they have no running water, and they're living at home still. There's been people that have lived at home and kept themselves warm with a hairdryer. There's been people that have been in their home and not had running water for a really long time. So I anticipate, and I've talked to Bob, and Shar would say the same thing, this is only going to increase. We're going to see more elderly people that can't stay in their home and that need services that aren't, I mean, we're kind of stubborn, because I consider myself elderly. We're kind of stubborn. We want to stay in our home, and we want to do what we want to do for ourselves. So just a little bit about that. And then Kitty Roads is our 10 apartments licensed to be a CBRF, and it still is not opened. And it's because of workforce. We would need to hire 11 personal care assistants, or CNAs actually, for that unit to open that facility. And I need that many in my nursing home, so I don't want to open Kitty Roads because I don't have the workforce. The other thing we do is we manage our census to our labor. So if I can't have 50 residents and have staff that can take care of 38. So we really manage that. So, but by managing the case mix, it makes a huge difference, and that's shown in our numbers. So, does anybody have any questions?
Sandy, do you want to talk a little bit about the classes that you guys offer? And who are some of the folks that are members of that group?
The WIS Caregivers, are you talking about? Okay. WIS Caregivers is it's actually a state now project that they actually offer nursing assistants free nursing assistant classes, and then when they come to work for you for a year, they get we're signed that we're going to pay them bonuses. $500 after 6 months, and then I believe it's $250 or $500 after a year. But the state of Wisconsin actually pays us to train them, so we get paid for the nursing assistant class. And then we're working right now on a mentor program because we can get paid for doing a mentor program too. Any questions about the WIS Cares program?
And some of that, we've retained some of those folks.
Absolutely.
To work right at the, at our facility.
A lot of times they come to our facility at high school. Out of high school, it's a work release program, and then we have them for several years because they go to college and they come and work on their breaks, depending on where they're going to college. So, been very beneficial, and Carol has been very, very good about our educator reaching out with the guidance counselors to all the area schools.
Any other questions?
Back to the Orchard View Terrace, you said that it doesn't require a nurse, but you have one in there. Is there a budget? I mean, where does that come from?
There's a budget, and we're paying for those nurses. It was, they're the manager. They're managing the apartments, and it's been built into the budget since we opened.
Okay, so, because it would be cheaper to have a nurse on call than a nurse on
Yeah.
premise.
But when you open a facility, it's a lot of work, a lot of intensive work. She does all the tours, she does all the contacting of families, she does all the ISPs, individual service plans. So there is a lot of benefits to having a nurse in your program.
That's
Okay.
on staff. Okay, thank you.
Any other questions?
Anything else? Go ahead, Deb.
So the requirement for a licensed nurse in the skilled facility is for an RN, is that correct? Not,
RN or
Or it can be
LPN,
LPN,
but we
okay.
have to have at least 8 hours of RN per day.
okay.
And right now, they're working to put in minimum staffing requirements. The federal government wants to control our staffing too. It's very frustrating, actually. They would rather we have RNs on three shifts. The unfortunate part about RNs is we're so close to the border, and hospitals pay significantly more than we can pay. So, yeah, we have a couple really long-term leaders in our building, and we just had a couple RNs. One was an LPN, brand-new RN, going into a hospital, and another one is going into the hospital with the hospice in combination. So, and hopefully they'll come back. They're on call still, so I'm hoping that and they have been picking up.
Anybody else? Thank you, Sandy. Review of services provided by the healthcare campus.
So the mandated service is, we're not mandated, but we do have lots of regulations. The nursing home industry is more regulated than nuclear power. If you ever want to see the regulations, come on and see me. I'll show you the 800 and some pages of regulations. Anyway, so the St. Croix Health Center is under the Napa Fire, the CMS 483.10 through 483.95, and then this was state statutes. A reduction of these would cause, greatly cause some deficiencies in our community. So, yeah, I don't know if you have any questions about any of that.
So we take medical assistance, but not all nursing homes do in the area. I mean, I'm thinking of I have a friend who is in need of care and wasn't able to get in some of the places because they were private pay and they wanted it all up front before they would get any medical assistance, and that's unrealistic, right?
You're talking about
Medicaid.
You're talking about Medicaid, and I'm sure that you're talking about assisted livings. Assisted livings have to, the home and community-based waiver, they have to apply and have the home and community-based waiver. Some assisted livings chose not to do that. We have that, and we've budgeted for a 50-50. So we have private pay and family care. So yeah, they do not have to have.
Right, so it's, you're filling a gap.
Yep.
On the mandated services, so the nursing home and whole healthcare campus clearly is not mandated. We're not required to be in that business. But we also don't have any tax levy dollars supporting the operation of the facility. So all of their expenses are covered by the revenues that they generate from the people that are staying there. We do pay for the debt service, though. So in 2015, when the county board elected to reconstruct the healthcare campus, we spent $20 million, which is paid for and backed by the taxpayers of the county. So the operating revenues are not sufficient to cover that debt load. It only covers the operating costs. The taxpayers do pay for the debt on that. So just so you understand the partnership there.
And Bob, I would like to thank you for each one of these folks to come up and give a presentation, to have this information that's here on what is mandated and what isn't mandated. That goes a long ways to help us out, and I thank you for that. It's a great deal of help, and again, we've had that conversation before too.
Any other questions? Thank you.
Thank you, Sandy.
Resolution supporting exploring options for development of a regional crisis stabilization center.
Thank you, Chair Telejohn. If you'll recall, about 6 months ago or so, we applied for some grant funding to possibly open a withdrawal management center at Kitty Roads using grant funds from the state. We weren't funded for that, so we didn't open it, obviously. But this resolution is, I'm asking for board support for a resolution like this to pursue any future opportunities that might allow us to operate a similar facility, whether it's at Kitty Roads or in some other location. But the idea of having a crisis stabilization center locally would benefit law enforcement. It would benefit us for treating people locally instead of sending them off to, say, Winnebago or some other distant facility to get help for a behavioral health condition. So my ask here, and my reason for wanting to put this resolution forward, was to to see if you support that idea of moving forward with looking for revenue sources or payment sources to fund a facility like this. Now, just recently, DHS came back to me with an offer to partially fund the original proposal that we put forward, but their dollar amount wasn't enough to pay for the staffing costs and everything else. However, there may be some billing options that we could look at moving forward that could help us reach a point of sustainability. I don't want to go into the detail of that because it might make Faye faint. And Shar and I are exploring whether or not that's viable. But basically, I'm just asking, is there support for, as we go forward, at least looking for opportunities that might allow us to operate a facility like this locally, which I think, again, would benefit law enforcement, would benefit us, would benefit hospitals, and the community, of course, by treating people more effectively and a lower cost and not require transportation to some distant facility.
Do we need a motion on this?
Yeah.
I got a motion, is there a second?
I'll second.
Thank you. Any discussion?
Bob, I thank you for all the work that you've been doing on this. This is one of the things that I think has been disappointing for folks up this way in the state. We have to take 2 officers from here to take somebody down to Winnebago. When they come back up to court, they've got to go down and pick the individual back up to maybe spend 10 or 15 minutes up here to turn around and have to take them back to Winnebago. We had one instance where when they got back to Winnebago with an individual, Winnebago filled the room, they had to take the young lady over to La Crosse. They got her to La Crosse, and La Crosse said Winnebago made a mistake, so they had to take her back to Winnebago and drop her off there before they could bring her, before the 2 of them got up here. And this is also one of the things over the years, Wisconsin County Associations has been asking for the state to go at least regionally and put a facility like this up here. And it's, I think this is it's a great opportunity for not only folks here, but in our part of the state. It's a win-win for everybody and a great help for these folks that need that help. So thank you.
Lisa.
I would still stand with not being at Kitty Roads. I can't support that one. And if it can be I don't know, that the revenue would be there and handle itself without, self-sustaining. I think it's an excellent idea, but I can't put it next to a nursing home. Grandma and Grandpa deserve more than that, so.
Thank you. And I would just say that these kinds of efforts are very complex and difficult to develop and manage, and we understand that. And to your point, I think we want to be thoughtful, we want to be careful as we can be about how we go about developing any sort of service like this, and we want to make sure it's sustainable so we don't open it and close it within 2 years or something. The one thing I would say, well, I'll just end with that. I do want you to know that if we have permission to look into this, that we're being considerate of all of those factors and trying the one financial piece about using Kitty Roads is that it saves us the facility cost and it saves us the cost of purchasing a building or renting a building or something, which I'm not sure I'd want to venture into without substantial funding. But we are looking at how we can sustain this with either current structures, billing structures around crisis services and grant funding, or through, hopefully, in the governor's budget, there's a proposal to include withdrawal management as a part of the Medicaid benefit set. Now, that's a complicated process as well, so I'm not banking on that, but there is at least movement towards that to hopefully have it included under the Medicaid benefits set by summer of 2025. I've been talking with association directors and state officials and others about how that might look and trying to help guide them in a certain direction around this. But again, we're not being careless. I don't want to be careless about this or just, venturing into the unknown. We have a sense of what this would take. I just want your support in terms of pursuing options so that I know that at least that's there, and then I can bring proposals to you for consideration.
Yeah, I also appreciate this coming forward. I think it'd be almost negligent to not at least explore what an option would look like. Having to go travel hours is not conducive to the health of anyone involved in that process. Especially mentioning that I heard that same case too, going to Winnebago, La Crosse, Winnebago, and back. It's not health. It's not only obviously, it's a given that someone who's in crisis traveling hours in the back of a squad car isn't help, but it's also more stress on an officer and resources that could be time that could be allocated elsewhere. So I'm fully in support of this.
And Bob, have you had input from, I'm sorry.
Apologies. So just to kind of recap, when we were looking into the Kitty Roads option, I was trying to do a little research on my own, figuring out, because I know there's a treatment facility in River Falls that almost exclusively treats patients from Minnesota because of how their healthcare laws are written there. And so I understand it that Wisconsin's healthcare law would not support something like this from a funding mechanism. Am I wrong?
It's possible to finance something like this through crisis funding. It's just very complicated at the moment. In Minnesota, we were successful in having this added to the Medicaid benefit set as a per diem rate. So we ensured up front that the per diem rate would be enough to cover the costs that a typical program would require. The staffing complement that you need to operate something like this is where the cost is, and even the previous funding amount that we were applying for through DHS would have come up short. The provider was willing to try and bill in other ways, medical services and other ways to make up that difference. But the challenge is in the staffing pattern and the cost for that staffing complement. Minnesota's, well, I won't go into it, but Minnesota had a reform of all of their addiction treatment services that I was a part of helping with that shifted most of the costs around treatment and withdrawal management to Medicaid, which helped establish a funding stream that was stable, and we don't have that here yet. Yeah. So it's more complicated here. It can be done, but it's not easy. But somebody's got to do it too, and we'd be probably the first one in the state to accomplish it. Again, we'd want to talk with law enforcement, local law enforcement, who would have to respond to any crisis events. We'd want to make sure everybody in the community was aware, and we don't want to just throw something out there and see if it works. We want to make sure that we have a good idea of what our support level is and what our financial sustainability options are.
Dave, did,
He answered my question.
okay. Sean?
Yeah, one last thing about sustainability is I wouldn't be afraid of, like, we spent $800,000 on services like this last year. If it saves us $400,000 from these services and costs like an extra $350 somewhere else, like, I'm okay with accounting that as part of, I guess, the sustainability aspect, because that's a cost we're saving somewhere else. That makes sense.
And the other part to that is it would be a regional facility, so we would probably contract with other counties if they wanted to either purchase beds or purchase in advance or purchase beds as needed from us. Again, the funding piece of that is where you get into the weeds, and it's difficult to figure out at this point how we make that happen without driving Faye crazy.
I'm very much in favor of this proposal, coming from a personal perspective, seeing my son taken over handcuffs in the back seat of a squad car with his hands cuffed behind his back for 5 hours. You know, it's inhumane. I think we do need a regional facility here. So I'm very much in favor of this. Any other discussion?
I agree. I'm very much in favor of it also. We've had these conversations, I don't know how many times over the years, and if something could be done and this problem could be solved, in my lifetime, that'd be wonderful.
Anybody else? I'd take a roll call vote, please.
Julie Maderas,
Yes.
Dr. Anwar,
Yes.
Lisa Lind,
Yes.
Sean Anderson,
Yes.
Kathy Leaf,
Yes.
Dave Osnes, Greg Telejohn,
Yes.
Mike Barkalow,
Yes.
Deb Lindeman.
Yes.
Passes, thank you. Public health permit fee schedule.
Mr. Chair, I'll turn it over to Lori, who's on Zoom tonight, to introduce this. That's okay.
Guys, can you guys hear me?
Yes,
I didn't come in person because I have a cold and I don't have much of a voice. So, Faye, if you can help me. Basically, we have the fee structure that we look at every year. And this fee structure is for one component of our environmental health program, which is the licensing and inspections. We permit and license and inspect about 625 facilities in the county. We have 3 agent contracts, one with Department of Agriculture, Trade, and Consumer Protection, which is food facilities, lodging, pools, camps, and campgrounds. And then we have 2 agent contracts with DSPS, Department of Safety and Professional Services, one for licensing and inspecting tattoo and body art facilities, and the other for manufactured home parks. So what we're looking at this year for fee adjustments are, one is we really don't have a choice on it. Our fees are composed of 2 components. One is the amount that we have to reimburse to the state each year, and the second is the portion of the license fee that we keep in county to support it. This license and inspection program is fee funded. We don't use tax levy to support it, so that's why we have to regularly adjust our fees to make sure that we're staying fee funded. So one proposal, we have 2 proposals. One is that we would only make the reimbursement adjustment that we have to for the state for Department of Agriculture contract. The DATCP contract this year, starting July 1, will increase their reimbursement from 10% to 11% in their formula. So we have to make that adjustment. So that's one proposal, is that we just make that mandatory 1% increase on the reimbursement amount that goes back to the state. The other proposal is that we would, in addition to the 1% reimbursement for DATCP facilities across the board for all facilities, we would also layer in another 1% increase. So those are the 2 proposals that we have. And when you look at the dollar amounts, we bring in roughly about $180,000 a year for the agent contract. So when you're talking about a 1% increase versus the 2% increase, it's roughly about $1,800. Is that right, Faye? the difference?
Yeah, that would be close to that amount. And basically with the reinsurance and the pre-inspection and re-inspection fees, I did include that in the revenue kind of recap this year. Just because we're getting a lot more money through that. So the revenue that we use to support this program, it's the annual fees which we adjust, but we also have the re-inspection and pre-inspection fees that go with it. And so basically what we have, the current rates that we have will support what we budgeted for the upcoming year without a fee increase other than the state surcharge. But we just, if you want to have that additional revenue to support the program, although I think Lori has said per guidelines, we're really not supposed to be making a lot of money. We're supposed to have the fees competitive, you know, not burdensome to our, I guess, vendors or, you know, companies here in town, so.
How many employees do this permitting? And what?
So we have 2 full-time, 1 part-time, but they also work in other programs as well. So between environmental health, the licensing, radon, and then the DNR. So they kind of touch all 3 programs. Their hours are split between them, and then Lori supports this program as well.
So this covers all their wages and benefits and everything to do this program?
Yep.
And transportation to and from sites and all that?
Yep.
Any other questions?
We need to vote.
Yeah, so you would need to, I guess somebody would need to recommend which scenario you want to approve, and then you would have to have a vote on it.
So we need
know.
a motion.
Yep.
Go ahead, Sean.
I'll make a motion to do the annual permit fee changes, but only including the state surcharge adjustment, not the 1% fee increase.
With, and the 1% increase?
Without.
Without.
Yep.
So the middle column.
Yep.
Is there a second?
I would second.
Any discussion? No discussion? We'll take a roll call vote. Lost my little note.
Julie Maderas,
Yes.
Dr. Anwar. Lisa Lind,
Yes.
Sean Anderson,
Yes.
Kathy Leaf,
Yes.
Dave Osnes. Greg Telejohn. Mike Barkalow,
Yes.
Deb Lindeman.
Yes.
Motion passes for the proposed 2023 rate state surcharge adjustment only. Thank you.
Thanks, everybody.
That's it for business items. Any requests for future agenda items? Any announcements or correspondence? Go ahead.
Everybody's had a copy of Aging Advocacy Days, which is coming up on May 9th. I would encourage anyone that wishes to go to get a hold of Kristen Newton, our ADRC director. This is an amazing event. It's a one-day shot in Madison. We're talking about all the different issues that are going on with our aging folks in all the different areas that they're at. You have the opportunity to talk with our locally elected officials. 3 years ago, before COVID, when the group went down, we had over 350 participants. And anybody is welcome to go. We left you a copy of each one of our representatives for St. Croix County. And if anybody would like to know, let me know, and I can give you all the committees that these folks are on. It's amazing. And they look forward to, this is one of the things they really look forward to is folks coming down and talking about this particular area. So if you want to go, please do, and if you can't make it, take the time and send a letter down and let them know what your thoughts are. Thank you.
Thanks, Dave. Any other announcements, Bob?
Just a couple of announcements here. We have a mental health summit coming up on Friday in Madison that will focus on designing systems of care within Wisconsin that are more responsive to people with behavioral health conditions that interface with the courts. Going from St. Croix County, or Judge Waterman, Sheriff Knudsen, Char Lopez, myself, Jolene Gustafson, who's Emergency Department Manager for Western Wisconsin Health, Phil Golly from Justice Support Services, and Chief Young from River Falls. And that's, again, this Friday all day, so I'll be able to report on that in future meetings. Our Recovering Together cafes are also starting on Friday at the Services Center. These are peer-led cafes where parents with lived experience talk about topics related to substance use or recovery from any sort of issue, whether it's eating disorders or mental health kinds of conditions. These are open to the public. They're voluntary. They're not a formal service. Facilitators have to go through training for a curriculum. Free to the public, free child care, meals provided, and I don't have the time in front of me, but it's this Friday morning. Do you remember when? I'm sorry, I should have written that down. While we look that up, our mental health symposium that will focus on addiction will be next month on the night of our board meeting, so that will serve as our HHS board meeting. The information for that symposium is on the website now. Adam posted it last night, so you can read about the agenda and what's going to be covered there. And again, that's open to the public. It's free of charge. It'll be at Northwoods Technical College, right across, kind of across the street from us. On May 17th from 5:30 to 7:30 p.m. Dr. Anwar is one of our keynote speakers for that. And we'll send out our annual report. Colleen's working hard on putting it all together prior to the board meeting so you can have a look at our 2022 annual report. I'll present that at the county board meeting in June. And the last thing I was going to mention was that we're discussing with the Wisconsin Veterans Association potentially leasing an office to them. It's the program that we would lease the office to is referred to as VORP. It stands for Veterans Outreach and Recovery Program. They would operate out of our building across the hall from Phil Landgraf in Veteran Services. And they help people with, it's kind of like care coordination and case management for people with behavioral health needs and for veterans with behavioral health needs, and connecting them with services. So if that goes through, we have an office ready for them, and hopefully that will work out. I think that's all I had. Did you have the time of the?
I think it's 9 to noon. The room is reserved from 8 to noon, but I think they're coming to set up, so I think it starts at 9, the Recovery Cafe on Friday, 9 to noon. And our main 171, 172, the big rooms in the building, so.
If I could, thank you. If I could say one last thing, we're in the process of contracting with Western Wisconsin Health on an ambulatory withdrawal management project. That's using ARPA funding that was allocated by the board last year, or the year before. It was allocated by the board. And that is going to be an outpatient withdrawal management project that we're doing in partnership with Ailey Peterson and her staff. So I'll give you more on that once we get that contract in place, and operations start would be in May that we're scheduled to start those. I think that's it. Thank you.
And just to look forward a little bit longer, in the June meeting, I've tentatively got Peter Kildee, Executive Director of WestCap, coming in to speak to us about their programs and how they integrate with Health and Human Services and their programs and housing and so forth. So that'll be very interesting. Anything else? Hearing nothing else, we'll meet again at Northwood Technical College next month, and otherwise I call the meeting adjourned.